Well, welcome to this session in our Opening Heaven's Door training course. And in this particular session, I'm very excited to be sitting down with Dr. David Pearson. And I want to talk with him about the whole relationship between prayer ministry and medicine from his perspective as a doctor. So David, thank you for agreeing to do this. And the first question I really want to ask you is that, as both a doctor and as someone who I know is passionate about prayer ministry, how do you define this word healing?
I think it's very important that we're clear about it, because we can get focused into very narrow mindset about healing. And I think that our starting place might be the World Health Organization's definition of healing, which is that health is a state of complete physical, mental and social well-being, and not just the absence of disease. Now, as a Christian, you would notice immediately that there are some gaps in that. And you might also question whether that's a state that is attainable this side of heaven. And I think there are a number of us that would say that there are very few of us that always live in a state of complete physical, mental and social well-being.
What strikes you about that definition, though, is that we probably think of health in the much more physical realm, don't we? And the whole idea of emotional health, I think that the healing ministry addresses that. The social aspect of it, that's something quite different, isn't it?
Yes, and I think that within that social is the idea that relationships are important, and relationships with one another, within families, within friendships, within churches, within our community, and society at large, I think is extremely important. And that would be something that I would want to add in and emphasize within that definition. So I'd go on to say that the Christian view of healing is much more holistic, I think, than just looking purely at physical and mental and social, because I would want to say, to begin with, and probably when we're talking about Christian healing, the thing that I think is most fundamental part of that is that need for us to have a right relationship with God. And so restoration of our relationship with God and emphasizing the importance of the forgiveness that Jesus has bought for us through the cross seems to me a fundamental starting point whenever we're talking about Christian healing. And I would want to emphasize in my prayer ministry that nobody should leave a place of prayer ministry without being assured of God's love for them and that place of being right with God. And I do also think that is really a fundamental human need. We reach out in all sorts of religious ways to God. I think knowing that God has brought us back into relationship with him through the cross is a very important starting point for Christian healing.
So it's interesting, because that immediately differentiates the world of medicine from Christian healing, because the world of medicine is not primarily concerned about our relationship with God. They might, assess some emotional difficulties, I suppose, but that's not what a doctor is about, is it? To address our relationship with God.
Well, having said that, there has certainly been an emphasis within the health service in the past that people should be addressing spiritual needs as well as physical and mental and emotional needs. So I don't think that it's totally outside the radar, as it were, of a doctor or health professional. I think these days, though, it is probably less well defined within the health services than it used to be. And certainly I think the role of healthcare chaplaincy is changing enormously. But there is still the recognition in every healthcare professional's training that spiritual needs should be there somewhere,
Right.
in terms of what we understand.
Can I just go back a bit to that World Health Organization definition? One aspect of our, I suppose, well-being that is becoming more and more spoken about, but I don't think is addressed by that definition, is our environmental well-being, which is what I was sort of trying to think of as social as well.
Yes.
You know, the whole what we do to our planet and how we relate to our planet, that's all part of it as well, isn't it?
Yes. And in a sense, that is encompassed within that word shalom that we use quite a lot, is derived from this Old Testament context, where we see harmony with God, ourselves, others, and our environment as being all together in a holistic way within that sense of being at peace with things. And I think that's an important concept to hold on to, especially when we're talking about Christian healing, because in a sense we have to look more holistically, and we also have to look at people's environment. And I think when we think about environment, we can think of people who struggle maybe in very difficult housing situations with threats of violence around them that cause disharmony. I think we can also think of people who are living in poverty and who are struggling. We can think of homelessness. I think in all these many ways there are environmental issues. But you're quite right to add on to that. Actually, our sense of responsibility towards the wider environment, the wider what we're doing to creation is also really important.
Can we look at this word, holistic? Because my guess is that most of the, in a sense, the Sunday morning prayer ministry is probably quite focused on a person's perceived specific need. You know, I've got a bad back, I've got a headache, my neighbour's bothering me. It's quite specific things folk will come up for prayer. And yet, it's probably true that a lot of our needs aren't actually that, you can't put them in such a box. One need might actually have a lot of different contributing factors. Would that be true?
Yes, and we see this in the consulting room as well.
Right.
What somebody might present with actually might have a lot of underlying causes. For example, I've had people who have been struggling with some vague symptoms of fatigue, pain, difficulty mentally, feeling depressed, maybe feeling isolated, and all those things kind of impact upon our physical need. I think unforgiveness is a big area. I have certainly had people whose resentment against things that have happened to them in the past has totally controlled their kind of outlook on life. I can think of somebody else also for whom the loss of somebody close to them in a bereavement that has never really been resolved can impact them physically as well. So yes, so when I'm praying with somebody on a Sunday morning, I will also be thinking a little bit wider than what they're actually come to, and I would feel that it's part of prayer ministry to facilitate that assurance of God's presence and His purposes for them in a wider sense than just the thing that they've come to be prayed for. And you would also find that some of those things actually have deeper roots in terms of relationships or things that have happened to them in the past.
So when you're praying, much as I guess when you're in the surgery, you're looking for connections, you're looking for things that might be triggering the immediate symptom that is presenting itself.
Yes. I think the context is different.
Sure.
And probably your way of thinking is a bit different.
Mm-hmm.
But once a doctor, always a doctor. So although I'm retired, I still find I'm thinking
yes.
the same way.
Yes.
And that process of thinking what's wrong with that person begins when they walk through the door, really, or when you're encountering them. I would actually say that I think prayer ministry is a far more scary place to be than in the surgery, because in the surgery you've got you've got your experience, you've got all your medical toolbox there.
Yes.
Actually, when you're in prayer ministry, you've no idea what somebody's going to bring to you.
Yes.
But actually, you are totally dependent on God.
Yes.
In your ministry,
Okay.
and you know there's not really much place for thinking I can do this.
Yes.
Because actually, most of the time you can't.
No. All right. I agree it's a scary place, but I've never been a doctor, so I can't compare it to that. I want to look at this in a central relationship between how God uses prayer and how God uses medicine. Sometimes when you hear people's testimonies and people talk about, the way that they've been helped, they might say they've had a miracle when the miracle was not a direct consequence of prayer as such, but through medical intervention. And the idea is very much God could heal through prayer or God could heal through medicine. Does it matter? It's all God. What would you say? Is there a difference between God using prayer and God using medicine?
I would say that both perspectives are important.
Right.
And I certainly have known people who have responded in a large meeting to a specific word of knowledge and found instant healing of a medical problem that they have had for a while, and for which medicine doesn't seem to have had the answer, or not yet.
Right.
But I think also God has given us tools of understanding.
Mm-hmm.
There are examples in Scripture, of course, and we have been given a world and a creation that is absolutely full of wonderful sources of healing and medicines. I mean, an awful lot of our medical treatments that we have are derived from things that we've discovered in the past as being useful medicines that have arisen from nature. There are other ways in which we've developed drugs, of course, but a recent diabetic drug was discovered, and I might have got this wrong, but from a rare lizard in rainforest. So we're still actually discovering things that occur in the natural world that we can use medically, but that's to deviate a little bit from the question you asked me. But I think on the one hand, God has given us knowledge, He has given us understanding. We have an incredibly rich world, and we would be negligent or foolish not to use what God has given us.
Yes.
And so that is where I see medicine, but I also see that our journey through medical illness or through problems that we have may sometimes become more dependent on God actually working through those processes and be above and beyond those processes. Mm-hmm. So I don't see a problem with praying for healing but using the medical means at the same time, because I believe that God is at work in both.
Yes. But going back to what you said earlier, the healing the doctor is seeking to bring is of a different healing to what prayer ministry is about, because there's a focus there on this, in a sense, the relationship with God, that is first and foremost within that prayer ministry, because that's what we're doing, that's who we're addressing for.
Yes. And sorry, can I just add that I think it's important to recognise that, because for whatever reason, healing may not happen at the time when we've prayed for it or in the way that we expect. But what we can be assured of when we're praying is that God hears us, and actually what he wants to do in our lives at that point may be on a different agenda from ours.
Yes.
And there may be more important things that God is wanting to deal with, and that may be in terms of our faith, our relationship with him, or in terms of relationship with others, or other things that are going on in our lives that actually might have a greater priority in God's eyes than my problem with my knee, for instance.
Sure. I'd like to just, if I can, for a few minutes, try and get inside the mind of a doctor about this ministry of healing, because one thing I have sometimes noticed is that when, in our ministry, we have prayed for people, and some quite stunning things have happened, things that are beyond my explanation. I have sometimes noticed a reticence for some doctors to, rejoice quite as much as I would like to, in that they would probably gather and say, well, we got the diagnosis wrong. And so it wasn't really a healing from that. We simply got it wrong. And that's why, in a sense, that the cure has happened. What's the thinking behind that?
There are a number of things that I think I would want to kind of say in answer to that question. The medicine operates from a very scientific worldview, and all the time we are seeing new breakthroughs in terms of our understanding, and we're getting better, I think, in terms of our diagnosis, and the range of investigations that we have these days is vastly different from that which we had 20 or 30 years ago. So we are doing much better, I think, in a diagnostic way, but there are still huge uncertainties. And I would also want to say that the process of diagnosis is a process. It's almost like a journey that starts when you first see your GP. And your GP may say to you, well, I think that this is this. Let's try this treatment and see if that works for you. So there are several things that are going on there, really. One is that a doctor is always assessing probabilities and possibilities. Yes. So when you're faced with a complaint, there are things that are going to be the most likely explanation for the problem that you've got. Now, I may not have all the tools available to me to be able to make a precisely accurate diagnosis at that point. But the other thing I've got to be thinking about is, what are the possibilities there as well? Although 90% of the time this problem might be caused by this, actually, sometimes it may be the first sign of cancer or something more serious, or a neurological problem. And therefore, all the time at the back of your mind, you've got to be thinking of the possibilities as well as the most likely thing that this could be. And so sometimes the first thing that we do might not necessarily be, what is actually ultimately going to be the answer to this problem. And I would say that particularly around cancer symptoms. So there are some symptoms that we would call red flag symptoms. So for instance, a change of bowel habit would indicate that we need to exclude colon cancer before we think of anything else. And we can think of lots of other examples of that. So that's where your kind of possibilities come to the forefront. But even though the chances are that in this situation that may be unlikely.
Mm.
So all the time we're trying to identify things at an earlier stage and trying to treat them. So to come back to what you're saying about doctors perhaps being more sceptical, it depends really on how far along the journey that's got, and how sure we are in terms of our diagnosis. And so somebody might pick up from their visit to the doctor that they've got such and such. Actually, that might just be the working diagnosis.
Yes.
And that actually only time will tell whether that diagnosis is actually going to be right or not,
Yes.
or whether something else is going to manifest itself.
Yes.
So plus also, there is a process regarding investigations as well. So your initial referral for tests is not necessarily going to be the end of the story.
Yes.
There may be other tests along the line that you're thinking of. If this doesn't resolve, maybe we're going to have to look at this. And so the same would be true when you've been referred to hospital, that actually the thing that you're coming for initially, or the specialist that you're seeing, may not ultimately be the one that you end up with, or the way it goes. So I think that there are uncertainties around medicine that we have to kind of get to grips with here.
Yes.
And therefore that may contribute to some of that scepticism. The other thing I would say is there are two words that doctors hardly ever use, and if they do use them, well, they're probably going out on a limb a bit, and one is never and the other is always. And so because actually sometimes disease progression is a very uncertain business, and therefore being able to give accurate prognosis and to say, this is going to happen in a certain length of time is extremely difficult to do.
Yes.
And notoriously around terminal illness, we can be saying, well, we think it's highly unlikely that you'll see Christmas, but on the other hand, you might. Yes. So so there are uncertainties around that.
Going back to what you're saying about how we would be foolish not to use the natural world God has given us, and therefore, we are and should be desperately grateful for the whole medical profession. Do you find that when people are giving testimony about healing, that sometimes doctors get a bit pushed out of the testimony and a bit, as if they were, shame about the doctor, but God stepped in?
I hope not. Because actually, fundamentally, most doctors go into the medical profession because they are desperately keen to actually do something to make a difference to people's lives.
Absolutely.
And therefore, actually, your doctor is on your side.
Yes.
And not against you.
Yes.
And therefore, if something dramatic has happened that has improved your condition, the doctor might be a bit bemused and not like to attribute it too much to God's intervention. But actually, at the end of the day, I hope that the doctor would still rejoice with you that things are better, and primarily that he's not needed so much.
Yes.
But also there's something very interesting about testimony, isn't there? Apart from all the things that I just talked about in terms of the uncertainties around medical outcomes, I think Jesus said something in the parable about Lazarus, the man at the gate, the poor man at the gate, and the rich man, and how the rich man said when he was in torment, that he said, "No, let me go back and tell my brothers." And Jesus said, even if somebody were to rise from the dead, they would not believe you. And so, I think that's a very telling comment, particularly around this area of testimony, because it actually implies that there is something, unless it actually happens to you, that you're a little bit just slightly sceptical of stories. The other thing is that I think my story is my journey. And actually it's not anybody else's journey.
Yes.
I know where I have been,
yes,
and how bad that felt for me, and how almost impossible it has been for me to see a way out of that, and a future and a hope in that situation. And therefore, for me, the story of how actually God turned things around for me and transformed what seemed impossible into something that has now miraculously become possible for me is very much my story. And I think to be able to convey that to others who are looking outside and who don't share that story, there is a kind of a little gap in understanding there. It's kind of what William Temple meant, isn't it? By the when I pray, coincidences happen. When I don't pray, they don't.
Yes.
It's in a sense, it's my perspective of actually seeing God at work in my life.
Yes. Another, I suppose, I would say growth area, but I don't mean that, but an area of ministry that we have seen growing in recent years is what we would call, I suppose, end-of-life care. And, I sometimes, I remember somebody once saying, if Christians really believe in the wonder of heaven, why are we so desperate to stop people getting there? In the sense that for those of us who have this great faith in the wonder of Jesus, this life is not everything. There will be a whole new life with God that we are going to experience, and what it looks like we can only guess at. How does that affect, in a sense, our ministry? But both prayer ministry and the end of life care that I know the medical world is making great advances in. How does that work?
Yes. It's holding on to hope, isn't it, in the midst of what seems a terminal or impossible situation. Yes, I think it's in medicine. You can almost imagine two graphs going in opposite directions. And one is the graph of our active treatment. So if you're diagnosed with cancer, we pull out all the stops and we're throwing everything at it, as it were. If we're finding that actually our treatment is not working, then we will be starting to think in terms of what is going to make life livable for this person in whatever time they've got left, rather than throwing everything at it all the time that's going to make life miserable and might not actually cure them. And so in a sense your treatment graph tends to go down a bit.
Right.
Your palliative care graph
goes up.
Steps up more.
Yes.
And obviously towards the end we're putting much more emphasis on comfort and relief of suffering than we are on treatment. And I think in a sense we can see that with our prayer for healing too, can't we?
Right.
We can see that place of confident, authoritative faith prayer, all the faith I can muster for that situation and that condition. If, however, it seems that is not going to be the way, in a sense, our prayer might change a little bit in terms of actually our prayer for that person and their assurance of God's love and their place in heaven and the eternal perspectives, alongside our continued prayer for healing and relief of suffering and condition.
Sometimes it doesn't work like that.
It doesn't.
And sometimes I think, I don't know how you feel, I wonder if sometimes we can almost get in the way of someone having a peaceful death because we're still proclaiming, no, it's hold on to your faith, it's going to happen, you're going to be okay, just hold on. And we're denying something.
Yes. Yeah. And I think this is where being being realistic about God's perspective and the bigger picture is important in our prayer ministry, and the explanation that we give and the expectations that we carry and that we hope for. And we have to, in humility, accept that at the end of the day, actually, we don't know what the outcome of our prayers are going to be, and we have to leave it in God's hands.
Yes.
And I think somehow if we can hold on to that perspective at the same time as our confident, authoritative prayer that Jesus has instructed us, there is a tension there, but it's somehow leaving people with that place of understanding that there may be a bigger picture helps them also to cope with disappointment in terms of what they were hoping for in terms of healing. I think that's one part of it. But I think you're right. I think people can feel incredibly burdened that it's in some ways that they're holding on to something that's unconfessed, some sin that's within them, within their past, within their family. You know, that there's some blockage somewhere that needs to be removed for healing to happen.
Yes.
And I think to leave people with that kind of burden,
It's quite cruel, isn't it?
It's one of the things that I would counsel against in terms of prayer ministry.
Yes.
That we're very careful in terms of the words that we use that don't convey the impression that healing hasn't happened because there's something that we haven't yet discovered. I think this business of digging for unknown causes can be quite harmful. Not to say that there aren't situations where a word of knowledge and something that the Spirit is leading you into will put your finger on something that actually is important, that needs resolving, whether that's in somebody's past or in their family. Sorry, we've deviated a little bit away. I'm just thinking of somebody who we were praying for in the church a little while ago. And I remember thinking at each stage of that journey, there was something different that I was praying into in terms of treatment or hope for in terms of the cancer resolving. But I did kind of reach a point where I was thinking, actually, I think I need to be praying something a bit different now. There's a little bit of a change in terms of how I'm feeling about this, and therefore how you're ministering to somebody.
And did you share that this I'm feeling there's something different here, or would that not have been helpful?
Actually, at the time, that was something that I think I felt within myself rather than, and that can feel like it's almost admitting defeat, and I don't know how we can change that. And we have the same sense within medicine of that feeling like, this is a failure. This is something that we haven't achieved. Yes. Whether it's through medical means or whether it's through our prayer ministry and our healing prayer. I think we have to build something bigger in terms of our faith, just as you were saying about our hope of heaven and the realities of that.
I think for me, I think I try and overcome that sense of failure in the sense that, I think we often view good prayer if God does exactly what I tell him to do, and then it's a good prayer. Well, it just sounds ridiculous when you say it like that. This is, we're not dealing with a slot machine, are we? And it's like that.
And I think those situations are even more poignant where we feel cheated because somebody is dying before their fullness of time.
Yes.
You know, there is a sort of prematurity to that, and we are desperate for healing, and it seems all wrong, doesn't it?
Because that's part of the compassion that God has put on us, isn't it? And,
yes.
And if we haven't got that compassion, this ministry, we're in a dangerous place anyway.
Yes. Yeah.
David, thank you so much for this. You've spoken such wisdom. The relationship between the doctor and the ministry can be one of tension, but you've really brought it together in a wonderful way. Thank you.
Thank you.